I'm really pleased to join this webinar today. Just before I start, I'll just add my own acknowledgements of land and my own family. So I always think this is a very important opportunity to give people an idea of who we are and where we come from in health equity work, because it's so important for understanding why we do this kind of work, where our motivations come from, where our intentions lay. So I am really fortunate to have been born and raised and spent most of my adult life in the interior of British Columbia, which is the traditional and unceded territory of the Syilx people. And I also like to acknowledge my own family mixed ancestry. My grandmother on my mother's side was born to Fishing Lake First Nation in Saskatchewan and was Cree, and I also have Irish, Jewish, and Quebecois ancestry. And so my family's stories actually are really a huge part of who I am in this work and why I'm so passionate about health equity work. So when we talk about health equity, another part of just ensuring that we are on the same page and we're clear about our intentions is to take a bit of time to talk about our assumptions. So one of the definitions I really like about health equity is from the National Collaborating Centre for Determinants of Health. I think the glossary of essential health equity terms is very helpful. And essentially, when we're talking about health equity, we're talking about an aspiration. It's something we're striving for as a society, as communities. And this place that we strive for would be a place where unearned disadvantage is not the determinant of people's life trajectories or opportunities. So health equity means that all people, whether that's individuals, groups, or communities, are able to reach their full health potential and are not disadvantaged by social, economic, or environmental conditions. And just to ground that a little bit further, to show just how much of an influence those unearned disadvantages can have on people's lives, I'll give you two visuals or two slides here. This one is from some global data from 2015 that looks at different dimensions of poverty, including education, health, and living standards. And this cartograph was created by Benjamin Henning, and he has a really fascinating website called viewsoftheworld.net. So Benjamin takes massive data sets and maps, and he integrates them. So here what he's done is for any country who has a proportionately greater burden of poverty, he's ballooned those country borders. And for those countries that have a lower burden of poverty, he's collapsed them. And if I was showing this in a classroom, I would probably give you a moment to look at it and think through and see. But if anyone wants to put a comment in the chat box there about what you notice about this map, what are some of the patterns that you might be able to ascertain from this map? Just to see if anyone has any thoughts in the chat box here. I see a few people typing. I'll keep talking for a moment while people type. So I would say the patterns that we see in this cartograph, we could see reproduced. Yeah, North America looks smaller and non-existent on this map, absolutely. We could reproduce the same kinds of patterns that we see on this particular cartograph if we did it at a neighborhood level, at a municipal level, at a provincial level or national level. It doesn't really matter. We would see very similar patterns. I'll just see if Chantal has something else to add about the patterns. So North America is quite collapsed. Europe is quite collapsed. The countries that are most ballooned, India is extremely ballooned. Many countries in Africa are quite ballooned. Hear from, all right, great, thanks. So these patterns really fall along the distribution of wealth, resources, and power globally, and really have a strong historical connection to histories of colonization. And the data about these health inequities, these differences, these unearned differences between country populations is very well established. It's irrefutable evidence. And so the problem of persistent health inequities is not really one of a lack of evidence, but rather a lack of connecting knowledge with action. So here's a look at some Canadian data. This is from the most recent report from Dr. Teresa Tam at the Public Health Agency of Canada. So this was released in December just recently. and focuses on stigma as a determinant of health and as a health equity issue. And so you can see on this graph, there's an overview of life expectancy, and it's separated out the total Canadian population from Métis, First Nations, and Inuit populations. And you can see that there are actually I showed this slide to my students this week in a global health course that I'm teaching, and I asked them what they thought, and of course they noticed that there's differences between these three groups. And one of the things that I think was a really interesting conversation was, how do we know whether these differences are tolerable or not tolerable? How do we know whether this is an unfair disadvantage or not? Well, we can look at the difference between the total population. For example, the difference between males and females is just 4 years, whereas with Inuit, it's 9 years between males and females. And there's many reasons that this is happening. Another thing that stood out for me was just how amazingly resilient these communities are, despite everything that they've had to overcome as large groups with histories of colonization in this country. Still, the life expectancy is it's unfairly lower than the total population, but I also think it says something about resilience. Anyways, this report, I think, does a very beautiful job of showing the relationship between stigma, stereotyping, and issues of power, and shows us how this can be enacted at individual, interpersonal, and organizational levels and at the population level, and gives a very good set of tools for us to think about what we might do in response to these. So just one other tool I'll give you before I turn it over back to Annette after these slides. So one of the ways I think is really helpful for us to think about where our attention falls and what the root causes of health inequities are. Oh, this slide was an animation. Yeah, I know. I'm getting to it. Is to think about a metaphor of a forest. So if we walk into a forest and what we see right away are a lot of leaves and branches, and these leaves and branches really are manifestations of things that are going on that are connected through trunks and root systems and the soil systems. And so if we think about the leaves and branches as displaying the things that we can measure and pay attention to, these systematic and unearned differences in health outcomes and life trajectories, these are health inequities. We can imagine the trunks of those trees in the forest to be pathways between the social and structural determinants of the health and these manifestations. And then the surface root systems, what we might see just like what grounds the tree into the immediate part of the earth, are the social and ecological determinants of health. These are the conditions that we work, live, and play in. And the soil systems are actually what require a lot of attention and what is so hard to get at and can be risky at getting at in health equity action. And that it has to do with systems of power, structural determinants of health. These are histories of histories of colonization. It's the very fabric of society. And so things like climate justice would fall into these soil systems. And I would argue that we can do more and pay attention to the soil systems, and that we ought to be developing strategies that illuminate root and soil systems. This is where our attention needs to be going. Another way of displaying this, Sumi, did you want to speak to this one, or do you want me to speak to this one? This is just another representation. Okay, sure. So PAHO has also a very helpful report that shows the pathways between structural drivers, conditions of life, and health equity, and living a dignified life. And I think this is, so for people who the metaphor works, that's one way, but this is just another representation that gives that relationship between those soil systems, which would be the structural drivers of health, the conditions of daily life, these are the social determinants and ecological determinants of health, or the conditions that we work, live, and play in. And all of these are affected by intersecting factors like gender, sexuality, ethnicity, disability.
Thank you very much, Katrina, for that overview. I think it really helps provide some grounding for the next set of presentations.